Okay, so one of the assignments that that you need to do is the responses to the ATI communicator scenario. So what I want to do now for like 10 minutes, which because the video is only like 3 minutes, so maybe 12 minutes, is I'm going to put you in breakout groups, and you need to go to ATI into the Apply tab, and you're going to go to Communicator, the Communicator 2.0. So breakout groups, ATI, Communicator 2.0, and you're going to go to the module that is the technique identifier, respecting clients' cultures. Right there, respecting clients' cultures. And I already did the case, but what it will do is take you, hopefully it will launch it in a new window, which I will move over. Here we go, make it big. And it gives you a case. It's a little case study where the nurse is going to do a home visit. So what we're doing is going to take the cultural aspect from theory and move it into lab, where we're going to also be talking about home visits. And so you've got the characters in the scenario here. You can, you know, click on them to get more information. And then as a group, maybe one person can play the scenario, or if you guys want to all do it individually as well. And then you begin the case, which is the actual video, which plays, like I said, for like 3 minutes, I think. And then there are a series of about 10 questions. And so what I would like you to do is in your groups is go ahead and look at the video, talk about it a little bit, and then you can answer the questions together. And then that's what you're going to upload to the assignment, individually, not in the group, but you can, there'll be like a question, and then you just write if it's therapeutic or non-therapeutic, and then you get your score at the end. I think you actually get a, the module, a report that you can upload, but you can do the questions together. Does that make sense? So you can upload the report module at the end, but you guys can work on the questions together. Did I lose people? Are you still with me? Yes, but we're going to take care of it today, and then you won't have to worry about it. Does that help? Because it should only take like 10 or 12 minutes. The scenario is pretty straightforward. And the questions, because we've talked about communication and culture already, the questions should come pretty quickly. So I figure if we can use it as the segue into the home visit and get it knocked off your to-do list. Does that sound
perfect?
Perfect. Okay. So so are you clear where you're supposed to go? You go to ATI, to your apply, to the communicator, to the one about culture. Right? And you're going to do that in your,
and we each do that.
Yeah. Well, it depends on what you want to do as a group. If somebody can play it for everybody in the group and you watch it together, that's cool. If you guys want to just watch it on your own for the 3-4 minutes and then, you know, come together, that's fine too. Whatever you guys want to do in your group, and then answer the questions together, like talk about the scenario and answer the questions together. And I'll try and pop into the groups. Did I lose anybody? Are we good?
Sorry, you said go to the communicator, and then which module is it?
It's the Communicator 2.0, and then it's cultural, thank you, respecting clients' cultures. Thank you, Roberto.
Okay, found it. Thank you.
Yeah, okay. So let me do breakout rooms. And I was thinking a little bit bigger breakout rooms this time. So maybe 6 to 7.
Technique identity.
Yeah. Alrighty. And then I'll pop in, and then I'll let you know when you have some time before you come back.
Ms. Solinger?
Yes, Amarani.
Before we go, I don't see the Communicator 2.0 on my ATI.
On apply, go to the apply tab. My ATI apply?
Okay, thank you.
You're welcome. Okay. 40 or 39 in the group, is that what you're saying? Yeah, no, nice try. Whoops. Just for that, I'll make it 2 people in a group. No, all right, 7 to 8 in a group. All right, have fun. Oh boy. So let's see. Recording. All right, so how was that home visit for you? Was it, I don't know, because the one nurse was leaving, right? And the other nurse, no, the PT, right? He was physical therapy, was coming in.
Yes.
I got a little upset when he was doing what he was doing, man. I mean, like I try and be as respectful of people as possible and respectful of not only of their cultures, but just respect just in general. I mean, I would never think to walk into somebody's house, you know, and just be like, hey, I'm here, you know, like, no, like, I mean, unless there is a stated order for something like that, where they say, you know, the patient is unable to get out of the bed, you're going to have to let yourself in, you know, but showing up early, just walking into somebody's house, you know, you can see he's obviously in the middle of something, walking up and putting out your hand to try and shake his hand and stuff. So
somebody in our group called it, was it cringeworthy? It was uncomfortable.
And it's meant to be that way. I mean, it's a little to the extreme, right? Yeah, I had a bioreaction. Yeah, it's like, what are you doing? Like, and the nurse clearly prepped him to that he shouldn't be doing that. And that comes to not only the culture, but like the safety. Like, has anybody done a home visit? Sounds like he's new. Yeah. Has anybody been on a home visit or done home care? Yeah, Isaac, have you? Yeah. What do you have any tips for home visits or being in someone's home?
I just mainly try to adhere to, you know, if they ask us to do something, try to do it. But in some senses, like, you know, if it pertains to your safety, you obviously can't do it. Like, I've been asked to take off my boots, like, while going into someone's home while on calls and stuff. But for our protocols and safety, we're not allowed to. So,
right. That's true, because you don't know what you're going to step on.
yeah.
For sure. Someone said, don't let the dogs out. Yeah. You want to make sure that you're safe, right? Don't let the dog out. Yeah, I'll show you where the assignment goes in a second. What about, like, did he do his prep work? No. Or did he do it effectively? Maybe how effective was his prep for the visit? Maybe is a better question. Yeah, I mean, he's like, no, I don't know. Right, he didn't know his client well, right? Yeah.
He showed up when it was convenient for him and not for the client.
Yeah, exactly. No, he thought it might be convenient for the client, but it was really self-serving. It wasn't, I feel like he just said that, right? Yeah. Oh yeah, people have guns and stuff, right? Yeah, no, Greg's saying people have guns, right? And if he wasn't expecting the PT for an hour, you know, the client might have been scared or something. I don't know. I mean, anything's possible in this day and age, I think, unfortunately. Yeah, go ahead, Francisco.
Oh, so I've done home visits, and sometimes there's a like that grace period where you're like sitting on the couch talking to them, and you're like, next thing you know, it's like 15 minutes in, and then you're like, okay, I need to get to like bathing your husband, you know? I'm like,
yeah.
So there's that too, where it's like, you know, that they don't get a lot of sometimes they're like, oh, I have bad knees. Thank you for coming. My husband weighs a lot. He's a lot dead weight now. And, it's like, next thing you know, it's like, you're like, okay, I'm here for like 15 minutes sitting on the couch. Should I start, getting to do what I have to do while I'm here? But
Right.
yeah.
Right.
So.
And that's hard, but I'm sure the wife needed that, right? If it took that long, I'm sure that, that was helpful for her. But then the problem becomes, does that set you behind? Like if you have another home visit after that, where does that put you in your time frame? Because you also have to document, right? And so it can be kind of tricky. Yeah, good. That's just a little taste of what the ATI communicator scenarios are. We're going to look at a video case as well in a little bit. Let me share my screen yet again. So much sharing going on today. Yay. So what do you see on your screen?
Week 3 lab.
Week 3 lab.
Yay. Okay. So upcoming assignments, right? That's why there's a check mark, right? You already turned in your group planning document, right? Yay. Okay. So the cultural self-assessment, there's a discussion. I'm going to show you where that self-assessment is. And then there's a discussion on that. You know that if you click here, it should, fingers crossed, take you to the discussion, right? So you don't have to hunt for it. It's right there. And so basically you're going to complete the self-awareness questionnaire, which I can show you in a second, and do your initial post, which should be the pattern, due by Monday, and then you respond to the 2 peers due by Friday. It would be helpful to not respond till after everybody's posted by midnight on Monday, just to make sure that everybody, you can respond to different people and not always the fast posters get responses. For this one, there is no word limit. You don't need a citation. Just try to include something from the lecture or reading or something in there, but you don't have to cite it or anything. Yeah, no word limits or anything, or word. So that's a little bit less, hopefully less pressure there, just more free flowing. This one's a little more personal, which is kind of why I did that. The cultural self-awareness questionnaire. So this again is segueing from talking about culture into the home visits. So you're basically going to do this self-assessment. I view human difference as positive. I have a clear sense of my own ethnic cultural identity. I'm aware of my stereotypes. These are pretty personal questions, right? If I'm a white person working with a person of color, I understand I'll likely be perceived as a person with power, racial privilege, that type of thing. So we're not asking you to turn this in. This is yours. This is your personal self-assessment. What we're asking you to do is, after you've completed that, then to reflect on your feelings and thoughts while completing it. Were they easy? Were they difficult? Any of your answers surprise you? How do you think it will help you in providing patient-centered care in the hospital or in the community, right? And then for your response to your peers, basically all you have to do is provide support for whatever their statement was, or take the discussion further. What were the similarities, differences? Was there any aha moment? That type of thing. Does that make sense? Questions on the discussion? I think it's a little I don't want to say less stressful, but you don't have to have a citation and that kind of stuff. So, so that's good. And then go back, lab. Okay, and then that's just, now you just did the ATI communicator questions. This link should, which is why there's, yep, right there. So, oh look, 5 people have already submitted. Thank you. So there you go. Yeah, I have to change. It's 10 points. Yeah, you're good.
I have a question about that.
You guys will get 20 points. Yeah. This one's wrong. I need to take out the post test because that's for something different.
I
So
no longer have a question.
Yep. So it's 10 points for this one. And then dun, dun, dun. That's what happens when you do it at 2, 3 in the morning. The way my mind works, just so you guys know, is most everything lives up here for the majority of the time. And then when I have time, it spews forth into Canvas. So that's why sometimes things change late or whatever. It's always living up here because I'm constantly, that's the explore piece of me. This is the part for the post test. So this is a video case study on cultural diversity. So you go into ATI, so that's where you're going to upload, that's the post test piece of it, which is 10 points. Oh, look, already one person. Wrong post test probably, but that's okay. Video case study. So you're going to go to your, where you were before, same place, right? As the communicator is, go to video case studies, right? Modules. You're seeing ATI, yes, no, maybe? Bueller?
Yes.
Thank
Yes.
you. Okay. Figured Bueller would help. Of course, that dates myself, but you know, anyway.
Yeah, see, for some of us, maybe.
That's a classic movie.
We got some.
It is.
That's on you.
I know, right? So culture diversity, right? So it's a little case study that you kind of do thing. And then you do the 5, there's like 5 post-test questions. These are the new and better video case studies, which I like way better. You just watch the little scenario. You do like a little written response. You don't have to record it. You could, it's like Flipgrid kind of, or you could do it written. Then you watch the expert response to it, and then you do this little reflection, and there's a post test. So it's pretty straightforward on that one. Either comments or questions. Yeah, that's okay. Let's see.
Can I ask a question?
Sure.
Or I guess maybe an observation. The post tests before, I just wanted to say this in case anybody else was feeling the same way. But for the vital signs, hygiene, and other one, like I did not do that great in the post tests. So I hope that's something we'll learn with time, you know, as our nurse.
Okay, are those ones? Yes, Francisco, in the apply tab. I can't necessarily speak to 48 because I'm not sure how they're doing it. Is it on the first attempt?
Yeah.
Yes.
Okay, so let me talk to Ms. Clark because she and I had talked about that. I'm not promising. I thought that she and I had agreed that we would do it on however many attempts. Mr. Espinas tends to like to do it on the first attempt. So let me double check for you. Okay, I can't promise anything, but let me double check.
That's okay. I just wanted to
for you.
Yeah, I just wanted to let everybody know that, you know, I didn't do great. So if anybody else was feeling that way.
No, thank you. I appreciate that. That's reassuring. Sometimes when I take them, I don't do so great the first time either. Just saying. All right, so let's do. All right, so we got that. That's done. You know about the discussion. You did this in class. You know where to go for that. Told you that a completed culture assessment was due by Thanksgiving in some way, shape, or form. Any questions on that? Because that's generally what you guys. Page. Correct. Just upload. Yes. Everybody clear on the assignments? Yes. Okay. Somebody. Okay. All right. And so now we're looking again. We're looking at the culture and spirituality in terms. I am in the lab. Yes, I am. Okay. And into a home setting and how to initiate that first contact, how to get into the home and or when you're on the phone, when you're doing your VITAS. Yes, we realize VITAS is in 46, but you are in essence doing a telehealth home visit with them when you're talking, right, when you're doing your interview or talking with them. And then you're also assessing your own level of cultural competence, which is what you're gonna do with that self-assessment. And then I showed you in theory in that on Giddens, page 34, I think it's box 5.3, that shows you a cultural spiritual questionnaire. And that's what you're going to use as yours that you're going to ask your client at some point, and that's what you'll upload. Having said that, do you ask all the questions on the questionnaire? I don't know. That depends. Depends on how the conversation goes. Depends on what the point of your visit is. And so what I want to show you, let's see, let's do this one. So we're going to talk about, let me just talk for a little bit. So we're going to talk about home visits. Let me stop sharing because we don't need to look at that for right this second. When you are going on a home visit, and I have experience, I've been a home health nurse. I have done supervisory visits. I've done actual shifts in the home. So like, you know, in the living space of people. My background is pediatric nursing and home care. And so when I go into a home, usually it's, 5.2, thanks. When I go into the home for the first time, oftentimes I've met the patient in the hospital because there's discharge planning and care coordination. So I try to develop a relationship at that point, but that doesn't always happen. Sometimes I am knocking on the door for the first time. Hi, I'm Shanine. I'm the nurse from such and such place here to, you know, take care of, you know, baby Joe, whatever, you know, whatever. And so you're coming into their home, right? It's not your home, it's their home. So sometimes I will ask, you know, would you like me to remove my shoes? Or they will tell you what they would like you to do. You know, please leave your shoes at the door, or, you know, you can wear slippers or whatever it is. And generally they'll give you a little tour of the house and, you know, show you where the patient is, depending on how it's going. And for the home care visits I did, for when I did shift work, like the child has their own space, probably like an adult does too, right? You have the adjustable bed and maybe the oxygen concentrator and the equipment, right? They have their own space, and that's where you're going to be staying. But there could be siblings, there could be grandparents, there could be neighbors, there could be dogs, there could be cats. I'm allergic to cats. So, you know, you have to kind of take those things into consideration. But anytime you're going on a home visit, anytime you're preparing to take care of a patient, like on your clinical day, you want to score points on your first clinical day, have a goal set for yourself. Always have some pre-work, always have a goal. My goal, the reason I'm doing this home visit is because I need to, let's see, okay, so say we're having a cardiac patient, they've come home after cardiac surgery, so they're doing some rehab and physical therapy, and I'm the nurse that's kind of setting that up and checking their medications and that kind of thing. So my goal for my first visit is to get into the house, introduce myself, get to know my patient, maybe go over medications, maybe just go over the PT schedule, and set up a follow-up appointment, right? Those are my goals, right? I'm not gonna walk in blind, I'm gonna have some goals set. So when you have your first shift on Tuesday or Wednesday, if your clinical instructor asks you, what's your goal for the day, right? Think about that. Is it to walk into a patient's room and say hi? Is it to take vital signs? Is it to have a conversation with a team member? Is it to just make it through the day without crying or screaming? All good goals. But that's what you want to do, is like figure out what it is your goal in there. Another key piece of home visits is safety, right? You need to make sure that the environment hopefully is safe. We talked about this. I talked about this with the A-team, right? With Chinatown, right? We had that little talk about, you know, making sure you don't go by yourself, just being really aware of your surroundings. My husband used to work for Rent-A-Center, which is a rental, they do like rental furniture and stuff. And so all his delivery guys were in we were in Pittsburgh at the time, Pittsburgh, Pennsylvania at the time. And all his delivery guys were in all the different neighborhoods. Some neighborhoods are better than other ones. So if I was going into sort of a questionable neighborhood, or one where I maybe didn't feel safe because they had some gang stuff or drug things going on in there, I would ask my husband, hey, can you guys check this out for me? They would actually either go with me for that first visit, or they would let their contacts know, hey, this nurse is coming and she's taking care of this child. You stay away from her. So that was kind of cool. I don't know if that's still something that happens today, you know, that you could set up for today, but just to be aware of your surroundings. And in the house as well, like somebody brought up the point, somebody could have a gun in the house, right? So maybe as part of your safety assessment, you ask that, you know, do you have any weapons? Are they secure? How are they secured? That type of thing. And then let's see, and then you're in the house and you're doing it. So you have a set amount of time, right? But you might ask, if their spouse or partner, somebody wants to be present, who do they want present with them? And intake takes way longer. If you're just setting up these visits that are coming, you're going to be there at least 1 to 2 hours. My lactation initial visits are at least 2 hours just to, get all the information that you need. Subsequent visits, maybe, 30 minutes to an hour. And then when you, so you kind of want to stay on track, like Francisco was saying, sometimes you get behind because you're talking with the other family member and you haven't been able to get to the gentleman that you're trying to bathe or, whatever it is that you're trying to do for them. So you have to keep time frame in mind. And then you also want to, when you're done, when you leave or getting ready to leave, you want to have the follow-up appointment set up. Either I'll be coming back in a week or next week or tomorrow or whatever it is, or, my, this other person from my, from the company, Francisco, he'll be here tomorrow, but I'll be here, the day after. Make sure they have contact information, and then you leave. And then there's, we'll find there's a little debrief tool that we'll look at. How did the visit go, right? Again, how did your shift on Tuesday or Wednesday go? Think about what did you accomplish? What did you do? What could you have done better? Think about what the person said. Oh, okay. Maybe they were missing, they needed supplies, right? And so now you have to follow up and get them some supplies, right? So there's sort of this beginning, middle, end to this process. For VITAS, when you're on the phone with them, I'm not sure how that goes. You guys are going to have to tell me because I've not done VITAS before. And you'll be talking with Ms. Clark a lot about that. But I'm thinking the script should follow something like that, like a beginning, middle, end type of thing. Let me show you. Tamara McKinnon is the one that has put together what she calls the first knock scenario. And it has to do with home visits. How do you set up for the home visit? And so I wanted to share that with you. Not every slide, because this is a little bit more public health nursey than associate degree nursey, but the main points are really important. So I'm not going to run the show again. I'm going to find the important slides, if that's okay, if that works for people. So she put this together so that there was sort of consistency and people knew about how to go about, knocking that very first time. It's like knocking on the room, right? And even you guys in sim, right? We knock and you guys, it's like, oh, what am I gonna find? What's behind the door? And so she really wanted to make sure that there was some kind of expectation. And it also helps to, if you can do, we know that simulation helps, right? The more you practice, the more you do simulation. So why not do a home visit simulation? That was the other reason that she did this. So I love this because people always have stories, right? What happened, what went wrong, what went right. I had a home visit in a home that had some Romanian people in it. And I was told, oh, you're going to the gypsy house. And so that was kind of interesting. Like, what? Any stereotype that you had, right? You got to leave at the door. It was great. So, and we want to make sure that things are positive. We want positive outcomes. So this is sort of her, when you hear first knock, this is the picture that comes to mind. So we just talked about this, right? You're going to assess and address safety, right? We did that. Develop rapport. Francisco was talking a little bit about that. How do you develop rapport? Right? What are some things that you can do to help develop rapport?
Find something to compliment about the house, the home.
Oh, there you go. Make a comment, something about the house. Oops, sorry. What did I do? Are we back on first knock? Yes. Okay. I'm sorry. Yes. Make comment on something. Sure. What else?
We're seeing your desktop. Are we supposed to see?
Oh, desktop? No.
She's really nice, but.
Well, thank you. You're not. Try this again.
You could like ask like how they're doing, even though that you're there not for them.
Oh, sure.
Just ask like how are you feeling today? Are you okay?
Oh, yeah. For sure. Are you seeing the first or the guy swimming?
Yep, we're seeing a PowerPoint now.
The first knock?
Yeah.
Yes, okay, not the guy swimming, okay. Okay, yes, develop rapport, any little thing that can get you, quote unquote, in the door, right? And develop rapport. And so then you're going to, so it depends. The client could be the person that you're talking to, or it could be a family member. So either way, you're going to discuss the client or discuss with the client and let them know why you're there, right? What do we tell you in the first 5, right? You walk in, today I'm here to take your vital signs. Here to do your head to toe assessment. Same thing in the home, right? Today I'm here. I understand you've just, been discharged home from the hospital after your cardiac surgery, and I'm the nurse that's going to be helping set up all your referrals and your follow-up appointments, do some medication, right? Let them know what your roles and responsibilities are. And then you're going to identify goals, like what is the patient, again, specific and measurable, what does the client want to achieve, right? And you can also kind of get some of your goals for them in there too, but you're going to have this conversation together. And they're going to say something like, well, I'm really not sure. I have some new medications. I really would like to understand my medications better. And so then you set a plan for that. I would like to understand, or I'd like to be able to move. It kind of hurts when I move. I like to be able to move without so much pain, right? And you're going to go through that. You can also give them community resources based on their needs, what they're wanting, and then discuss the plan for subsequent visits. So I am going to visit you once a week. Do Tuesdays work? What's a day? I have Tuesdays and Thursdays available, right? Don't let them say, well, you can only come on Fridays. Well, they might, but but try and find a mutual time so it's consistent, and then they know what to expect. Right? They know you're going to be there Tuesdays at 2 o'clock, and that's very helpful. And then wrap up the visit. So those are basically the steps to it when you're going to do a home visit. The other kind of visits I did besides just the shifts, which was actually like an 8-hour shift caring for a client in their home, would be what's called a supervisory visit. So it's also kind of like a Medicare visit where you go in and you're double checking physicians' orders and making sure that things are being done correctly. So it's the same type of thing, safety, rapport. I'm here to do this. What are your goals? Here's some resources. Is that making sense? I'm not sure you're going to be able to do that on VITAS because I don't know what the script says. But even in a telehealth call, I do phone consults for lactation. So it's the same type of thing. So you're going to do your prep and kind of brief. That's what we're doing, like simulation and debrief. That's kind of what we're trying to do today. Not in so many terms, but you're right now, that's what we're doing, those prep activities, right? The cultural self-assessment, we're talking about safety. We have we talked about the communication, that kind of thing. And then you're going to, like for VITAS, you've taken these, the prep classes, right? You had the video and all that. So you're doing, that's your pre-brief activity, right? Before you're actually going to do your home visit. And then if we had a sim lab, or if we have time, we can do like a potential simulation. And then when you're done, what was it like for you, right? Like that should be part of the debrief that that Ms. Clark is doing with you on the telehealth, right? How was it? What surprised you? What did it go like you thought it was going to go, right? Because generally you have a preconceived notion. Was it what you thought it was? Did it meet your expectations? Did you think it was going to be something different? And why are home visits important? Why would it be important to be in somebody's home?
Get a better feel for the way that they're living and what area they're living in, and just kind of what the situation is.
Exactly. Because it's one thing when you're my patient in the hospital and I say, take your meds at this time and make sure you do these exercises at this time and blah, blah, blah. And when you're actually in the home and you see what's going on, you're like, oh, no wonder they don't do this, that, or the next thing, because they can't. We're going to talk about patient education in subsequent weeks, but one of the best ways to understand that somebody understands what you just taught them or said is a teach back, right? Have them either state or do back, repeat back what you just taught them. Yeah, see how environment affects their health, right? Safer home environment, exactly. You guys are so on this. I'm like so happy. I don't care about that. I don't care about that. This one. Okay, I love, okay, so this one, there's no such thing as a typical home visit. If there was, like, if the client went from, sick to well and it was A to B, they wouldn't need us. That's not what happens, right? Illness is kind of can be an up and down thing. And so case management wouldn't be involved if it was just linear, right? And so we have, by looking in their home situation, we can help them pinpoint issues that are preventing them from having, effectively, excuse me, managing their care, like the adherence is one of the concepts. So we need to meet them where they are and help them move forward, right? We can give them some tips or have them tell us what's worked for them in the past. So this is in order to get change, right? The change process, you start them where they are. So say they need to do some exercises for their cardiac health, there's gonna be resistance. I don't wanna do it. And it's gonna be chaos. They're gonna fight it, kicking and screaming. And then slowly but surely, they're like, oh, okay, this isn't so bad. And they start doing better, and then they integrate it, and then it becomes their new norm, right? Does that make sense? So it's our job to help them get through the resistance and chaos, try to get them to the transforming idea, and then provide positive feedback as it's becoming the new status quo. I think it's 21 days to change. So my husband always tells me, if you do the same thing over and over again for 21 days, it becomes your new norm. I don't know if I believe that, but that's what he tells me. So again, safety, developing the rapport, what are the client's goals? I think health literacy assessment, although not part of our course, but I think it's important even in the hospital to understand what the reading level, if any, of the patient is. It could be that they're Hispanic and they can read Spanish, but they can't read English even though they can speak English. It could be that they are illiterate. They don't read very well. So how often do we throw a pamphlet at people? Here's your pamphlet, right? And I don't even know if they can read it, regardless if it's in Spanish or Tagalog or whatever, right? So I think giving them some options or something is nice. And we talked about teach back, subsequent visits. The other thing though is that the home environment, they have to learn that you're coming and hopefully not plan other things while you're there, and be clear, that you're there to help them and that they need to help themselves as well. That would be a case study, so I don't care about that. I mean, I do care about it, but I don't care about that. So I think that was pretty much right. And there's the simulation. We talked about the debrief. And then here it is. So part of, wait, hold on, let me do one thing here. My bad, there we go. So in the debrief, we talked a little bit about that again. What were you feeling? What surprised you? Was there something you would do differently? Experience that you had with this particular visit affect another one? So that's a good question for you with VITAS, right? These could potentially be difficult conversations, right, with palliative care and end of life. And so will this experience that you with your first client that you're talking to, how is that going to affect how you interact with subsequent clients in the same situation? Open-ended questions, active listening, no judgment. There's our first knock again. So we did that. Sorry, these are just all her things here. Her team, that was her team. Yeah, oh, I thought that was cute too. Yeah, so that's that. And so hopefully that that helps a little bit with like, I know we're not knocking on the door, but what are your takeaways from that? And then I'll let you go. Maybe. Because normally what I would do then is give you guys case studies and then have you actually practice with each other, you know, like knocking on the door, which I mean, I could do that if you want to do that for the last 5 minutes or 10 minutes, but I figured we spent a lot of time together already. And certainly we can practice that. You can practice it on your own as well, or in your own home type of thing. Ding dong, somebody's back. But what are your takeaways from home visit safety and how to do a, you know, make that first knock on the door?
I'm actually seeing a lot of, not necessarily for the safety aspect, obviously, but I'm actually seeing a lot of connections between the home visits and our VTAS calls. You know, especially that initial, hi, like I'm gonna be your, you know, your new contact or whatever from, you know, I'm going off script here, but, you know, I'm actually seeing like the building rapport and the kind of, you know, how we present ourselves, even over the phone. I feel like I'm seeing a lot of connection.
Awesome. I didn't even know that. Yay. Claudia, be mindful of what?
Sorry, trying to unmute it. Just be mindful of like, well, depends what you're looking at for the client. Like, like for example, if like they're Hispanic or Indian or their background, like just kind of like being mindful, kind of preparing ahead of time before going into the room, into the situation of where you're going to. So kind of collect your thoughts before going into depending on the situation, because it could be very broad.
Yeah. And yeah, we are a guest in their house. Exactly.
Yes.
Yes.
Exactly.
And then
it's like you're reading my mind.
yeah, this Med Cruz said that. Yeah. And then Vanessa's comment is that, you know, once you make one call, it'll be a little easier to start your own way of doing it. Remember, I believe the VTAS is scripted, right? It's the same script for every patient. Do I understand that correctly, Erin? Okay. And so, yes, I think all that experience, I think it will help you in the hospital situation, right? The more and more you practice interacting, you know, and meeting people, I think that's great. And yes, be respectful, exactly, because it's not our house. What other takeaways or related to communication, culture, spirituality?
I think sometimes if you're just, I mean, like open or just kind of cognizant, let me rephrase this. If you're observant, a lot of times you can pick up on these things. You know, if you walk in and there's crucifixes all over the wall or something, you can kind of, and you want to stay away from stereotypes, but you can kind of start to piece things together, and you know, you can.
You're noticing. You're exactly, noticing, aren't you?
Yeah, you're noticing things, so you can kind of start to piece things together, and then maybe that directs some of your conversation.
Exactly. So again, that assessment, and that noticing, right? Being aware of what you see. Maybe you walk in and you smell. Maybe there's some cooking going on, and there's a certain smell that has a reaction for you, or that you wonder about. Could be a conversation piece. Ooh, that smells really good. You know, what is that? Or, you know, hearing things, if you hear children running around, or, you know, there's a lot of things to notice that can help. Exactly. More effective in our job if we also take the time to get to understand our patients in a non-medical way. Yes, definitely. And especially in a home situation, because yeah, their whole home, physical home is changed around. Be open-minded, calm, confident. Yeah, they can feel your vibe. Exactly. And in home visits, again, I can only speak from like my pediatric experience, but I had one house that I went into that was kind of out in the woods and was pretty, not hoarder's house, but it could have been someday soon. Many cats, lots of cat litter, lots of cat food around. But the child's room was immaculate. It was amazing. And then I had another home that I did home care in that was basically a mansion. And the child had like their own wing of the house and their own refrigerator. Everything was, it was, you know, you never know what you're going to walk into the situation. So to be safe and as confident, right, as you possibly can be. What else? Any other final comments or anything on anything else from today? Do you feel like you learned something? I'm gonna stop sharing. There you go. Yeah, Emily learned something. Thank you. And you're clear on the assignments that you have to do. I will tell you if you want to look over, I just stopped sharing my screen. Setting goals. Yeah, setting goals. Yes. If you want to look at this module 102, again, it's not required, but it's really kind of cool once it loads. I think you have to like sign up, but it doesn't cost you anything to sign up. Oh, now she starts talking to me. But it walks you through like a whole thing of the assessment and going into the home and all that kind of thing. So it's really kind of cool. I'm not it's not like I want you really to do it. We're not doing in-home visits per se this semester. I'm pretty sure we're not doing any. But again, it goes through those steps, which is great. And then did I have more comments? Okay, so we're not always going to have this time on Friday. Let me show you kind of the plan. Where did it go? I'm hoping you're looking at the syllabus. No. Yes. Share screen. You're not looking at the syllabus because I didn't share my screen. Go away. Bottom. Dun, 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 dun. An emergency statement. Gotta love it. Okay, there we go. So when you get down to the bottom for the weekly concepts, it will have the theory and the lab component. So technically last week we should have had lab, but because you had success, I didn't do a formal one after class. It was actually in the parking lot, I think, but a lot of people had that, so we didn't do it. But basically you did that 75 minutes on your own, I hope, when you were doing your windshield groups together, right? And putting that planning document together. So that is the time that goes on your comportment attendance tool for the time. So a lab in this course, the time allotted for each lab is 75 minutes. And there are 14 technically labs, but they're divvied up a little bit differently. So last week 2, we should have, but you guys did it at home. So that's cool. Week 3, which is this week, is what we just did now, the first knock simulation, the home visit stuff, and that was 75 minutes. Next week is time allotted for your cultural assessment, for your VTAS, or if you were able to do a home visit. So you need to account for not necessarily next week, but in all, I believe it's 27 hours for the course, right? So lab 3 and 4 time is for doing a home visit or your VTAS. Is that double counting? Yes, kind of. But that's the best we can do right now. So week 4, there is no lab after class. Week 5, same type of thing. We'll talk about the family assessment in theory when we talk about patient education. Week 6, it will tell you no lab this week. Again, the visits, right? So there's really not another lab. I think maybe week 9 or 10, I'm going to add one in just to check in and see where people are with windshield right around that time that you guys have, your groups have to meet with us to talk about your windshield. But for like lab 10, that's for when you attend your COVID screening or immunization event, right? So that's definitely more than 3 hours. I think that's 4 hours, right? So that will help there. So really, we're pretty much done with lab after lecture, except for maybe week 8 or 9, somewhere in there.
Ms. Solinger, can I ask a quick question?
No. Yes, of course you can.
All right.
I just love it. You guys are so great because it's always, can I ask a quick question?
Well, now it's long, but so
what's up?
Just so the lab hours that we're tracking for NRN 47, these ones go on the 47 tracking tool and not the comportment tool.
For 46.
46.
Yes.
Okay.
Yes. So like the food bank, immunization clinics, the COVID clinics, yeah, that kind of stuff. And like count your windshield hours anytime your windshield group meets or you're going into the community, that counts as well. And then count today, count the 75 minutes for today.
All right, thank you.
Yep, that was a quick question. I like that. Okay, other questions? If not, I'm gonna stop recording and say goodbye. Ms. Clark will have you for nutrition next week. And I'll be back for, no, I won't. She'll have you for 47 as well. So next week is Ms. Clark's week, but I'll still be available.